Today, I'm talking with Dr. Michelle Tsunya, whose last name I probably just butchered. Sorry, Dr. Michelle. Dr. Michelle is an emergency medicine physician here in Victoria, British Columbia. She's a mom of 2 young girls, and she's also on Instagram at Dr. Michelle MD, where she shares reliable information about nutrition, fitness, and wellness. Being a mom of young girls and an emergency physician, Michelle's encountered a lot of questions and concerns, and even cases of COVID-19. Dr. Michelle and I looked through the literature and put together a podcast that you're going to hear now on the top 10 most common questions we get around COVID and kids. Welcome to the She Found Health podcast. We are Doctors Sarah and Alicia. We're maternity doctors who are passionate about caring for women and young families from conception through the first few challenging years of parenthood.
We have 5 kiddos between the 2 of us, so we get it. We've been there. And we made it through to the other side, and now we want to support you through your journey.
We are delving deep into topics to prepare you to have the healthiest pregnancy possible, the best birth you can, and to thrive rather than just survive during the newborn and postpartum phase.
We want to remind you that the information that we share is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The information we share may not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.
So, Michelle, thank you so much for taking the time to be on our podcast. Super excited to have you here. And I thought it might be nice to start by just asking you to tell us a little bit about what got you interested in sharing health information on social media and interested in sharing around COVID in particular.
First, thanks so much for asking me to be on here. Super exciting. When it came to posting on social media, a lot of it came around just issues with misinformation, of going online and just seeing how many influencers were posting things that were 100% false, and how confusing that was for patients, and realizing that there really wasn't a counter dialogue. There weren't a lot of people in medicine, or, at the time, a lot of sites like the WHO or the CDC didn't have social media accounts. And so there really wasn't this wealth of information that could counter a lot of that true 100% false information.
Mm-hmm. Oh, that's exactly why we started doing it too, with our focus around pregnancy and newborn care, because there is a lot of information out there. And then I guess COVID, just because COVID.
Exactly. Yeah. And so at first it was more just kind of things that health and wellness and kind of trying to talk about. Initially, my Instagram or my social media was really around health and wellness topics and evidence-based lifestyle things, as opposed to the industry that has become wellness and what actually has evidence behind it in terms of ways to stay healthy and stay out of emerge. And then with COVID, it really changed gears to trying to, and especially with families, because that really seemed to be the place where I was finding, especially in emerge, that people had so many questions and really didn't know where to go to. And it was just trying to add one voice or one more voice to the conversation.
Mm-hmm. No, it's awesome. I think it's super helpful. And especially for us, because COVID is so new. So being able to look and say, okay, yeah, she's sharing the same information. We're on the same page in terms of what we know. Because as you listeners will learn today, there's still a lot that we don't know about COVID. Right? So today we're going to go through top 10 questions that we get when it comes to COVID and kids. So first question, how does it present and what does it typically look like, COVID in children?
So this is, I almost feel like that's $1 million question that we're trying to figure out as physicians and as researchers in public health, is exactly how does it present, which is why the testing is so broad and why the symptom list, when people look at, depending on what you're looking at, 24 potential symptoms that are associated with COVID. So unfortunately, there isn't one constellation of symptoms that are highly reliable as saying, yes, this is COVID, as opposed to a cold, as opposed to a this. In adults, there definitely seems to be this sort of pattern where over the course of the 14 days, the vast majority of people at some point will develop a fever, at some point will develop a new cough. And then more and more, this idea of loss of smell seems to be coming in as sort of one of the more reliable ones. And then there's that list of 18 to 20 potential other things. With kids, it's even trickier, because where we're finding the cases in kids is that we're testing their parents and we're testing their grandparents, or we're testing their contacts. And that's how we're finding out that the kids have the illness. It's that asymptomatic disease, that asymptomatic illness. And so the interesting thing with kids is that their disease seems to be so much milder for the most part than adults, that yes, they might get fevers, but really not to the same extent that adults do. They sometimes get a cough, but the pattern does seem to be, it's for the most part very mild disease. But because they tend to be asymptomatic, that's where this sometimes intimidating list that the schools give out of, hey, the health checks of, does your kid have one of these? That's where that's coming from, is that it's so broad with them. What are you finding?
Yeah, I listened to a great podcast, and that's where I got a lot of my recent information. And it was that only 50% of kids have fever, right? And I think even less than that have cough. And so I think GI symptoms are a bit more common in kids. But what I found is exactly what you're saying, is kids don't seem to be getting it from the community. They seem to be getting it from their household contacts. Yeah. So typically I would say, how does it present? In kids who have COVID in the home.
Exactly.
Right? Yeah. And this is going to change, I think, over time, but for now, this is what we're seeing. So question number 2. Oh, I love this one. Are kids super spreaders? We hear a lot about this, right?
Absolutely. And I think with schools opening and then the media sort of, I just thought today, Quebec, I think it was 12 new outbreaks in schools. Like, that's such fear-provoking information, right? When no, kids are not super spreaders. No, absolutely not. While the idea of super spreaders is new term that doesn't have a formal definition, the WHO is sort of loosely associating it to be anyone who is spreading it at a higher than usual rate. But is that children? No, for the most part, that's going to be individuals, unfortunately, some of our young adults that are attending events that are involving large crowds, lots of close contact, bigger droplets. So it's something that you're dancing, you're maybe talking loudly because it's a club or a bar, and therefore your droplets are projecting to a much further distance. So those are sort of the events where sometimes sort of a quote unquote super spreader is found. But yeah, for the most part, no, kids.
Not kids.
Absolutely not.
That's good news for all of us who have just recently sent our kids back to school. Hey. Now this question I'm really excited about. And Michelle did a bit of research. What does the testing like? And can you talk about the new swish and swallow versus the previous standard of the nasopharyngeal brain tickling swab?
Yeah. So this is so exciting for parents that are in BC, because as far as I know, correct me if you know, if you've heard differently, but we are the only province right now in Canada that has this test. My understanding that we were sort of first to trial this. So it's school age kids K to 12, with the thought being that it's got to be a kid that can follow these instructions. So that's why it's starting at the kindergarten age. But that rather than having the previously used nasopharyngeal swab, is that instead they're having this sort of swish. It's funny that they call it a swish and swallow, because it's really a swish
and spit.
Yeah. So I don't know where the swallow came from, because we're actually asking kids, don't swallow the salty water. But that either the kid themselves can put the salt water into their mouth, or a caregiver can help them out. But it's essentially this process of just gargling and sort of rinsing your mouth with salt water, both in the front of the mouth and then gargling it. So getting the back of the throat for 20 seconds and then spitting that out. And that's what they're using for the swab, as opposed to the lovely tickling the back of the nose with the NP swab. Now, some kids, so especially younger children, so infants and any child that following directions, for instance, like I'm trying to picture my kids when they were 5 and trying to teach them how to gargle. it would not have worked at all. So is it going to work for all little kids? Unfortunately not. I think there's still going to be a little tickling of the back of the nose happening. But for some kids, I think that this is a great option.
And do you know how it compares in terms of like sensitivity to the NP swabs?
I haven't seen anything. I was trying to get someone, I was hoping today, I was like doing a bit of an email tag of trying to kind of get some of that data, and no, unfortunately not.
But if the CDC is endorsing it, it's got to be relatively on par.
Yeah.
Yeah. Yeah. So if we hear anything, we'll spread the information, share the information widely. Now, here's a great question, and one that you are probably encountering as a mom, because I'm sure all your non-physician friends ask you advice, which is totally reasonable right now in this bizarre time. But I get this a lot too, is when should you get your kid tested? What advice are you typically giving?
So the biggest thing, and because I don't know about you, but the one that kind of keeps coming up the most is runny nose, because what school-age kid doesn't have a runny nose? But it is, so there's sort of the official answer. So right now, the official answer from our BC CBC is, so if you have a child that either has a fever, so temperature, but I would call, I don't know what you're suggesting, but essentially temperature over 38 degrees.
Yeah, exactly.
And, so that's full stop. They need a swab if that's a new fever for them. And then any new symptom that's lasting for more than 24 hours. So it's not just kind of one day of being exposed to something and they had a little bit of a runny nose. It's no, they've got a new symptom that's persisting for more than 24 hours, or 2 new symptoms on that really long list. So for instance, if your kid suddenly has a sore throat and a runny nose, you're going to go in and you're going to get a swab. But if it was, hey, we were outside and kind of exposed to new allergens and a little bit of a sneeze and a little bit of a runny nose, and that's settling over 24 hours, especially if you're giving them their antihistamine, for me, no, I'm not recommending that those families get tested, especially if it's for them, it's their classic seasonal symptoms that they get every year at a particular time following a particular exposure. Then no, for me, that's not a new quote unquote symptom.
Yeah, I would agree with that too. And what we'll do is we'll put in the show notes all the list of symptoms that we recommend, and then any good additional resources like the CDC recommendations and stuff, because sometimes it can be hard to know where exactly to look. Another question we've been getting a lot of is what kids are more susceptible. People have a lot of concerns about kids with asthma or underlying immune diseases. In your research, what have you found about that?
So first, I want to take a step back when we look at the question susceptible, because if we sort of go to the first question, which was, what does COVID look like? It's really reminding ourselves and checking ourselves as parents, myself included, that this is a mild and often completely asymptomatic illness in children. So first things first, kids tend mild illness, and often we're only finding out that they have it when we're testing other family members. So in terms of susceptibility, I think we're sort of looking at it in 2 different areas in that. So one, there is no group so far that's necessarily more at risk of getting it. Everyone can potentially get this virus. It doesn't matter how old you are. It doesn't matter, if you're a newborn or if you're 99. If you have the right conditions, you are potentially going to get this virus. The second part, which is I think what parents are really asking, is which children are susceptible to getting really sick with this virus. And so that's the one where it does seem to be that overall, if we kind of look at the breakdown of kids that get hospitalized, only about 1 to 1.5% of children are unwell enough that they get hospitalized. So that's really reassuring. The kids that do seem to get it, though, are the younger kids, are the ones that we worry the most about. So that's going to be kids under the age of 1, definitely being at higher risk of getting sicker when they get the illness. And then asthma is just starting to become a new risk factor. And we don't fully understand yet why it's a risk factor. Initially, when I was first doing research on this, it was actually deemed sort of almost protective because steroid use, and that, maybe that actually had a bit of a benefit. But now it's seeming like it's swinging the other way. And part of where that uncertainty comes from is because we're dealing with such low numbers of kids that get sick from this to then draw conclusions. But definitely kids with chronic medical conditions, kids that are immune suppressed, kids that have illnesses like diabetes. And unfortunately, same as in adults, our children that are either Black or that come from Hispanic families seem to be affected more than children that are that are Caucasian, which is, we're still again figuring out why.
Mm-hmm. Yeah, I think you're so right. It's the numbers are so small and we're still so early. Yeah. And I also wonder too, the outbreak really came at the end of flu season, right? And now we're going into flu season and the season where we see RSV in kids. And if we're going to see more co-infection and perhaps kids who, have those infections getting more sick as well. But we have to wait and see with that.
Yeah. This year we were testing an Emerge right before. So with the lockdown, it was interesting as we were getting our swab results coming back, because we were seeing how often kids were co-infected. So even if they didn't have COVID, because we were sort of swabbing anyone that was coming in, we're just how frequently it was, versus where we never released a test that many children of exactly which virus it was. We would just say, hey, yeah, you're unwell with a viral illness. And then as we started doing that, realizing, gee, maybe one of the reasons that kids have such a broad symptom presentation when they're sick with the flu is because they're actually unwell with more than one flu strain at the same time.
Yeah, no, it'll be interesting to see what comes. Another question, and I think this is something that will be, we'll see over time, is have you heard of any long-term health outcomes from kids who've gotten COVID?
I haven't. I don't know that we have enough data and time behind us to know what that's going to look like.
Yeah, I have to say the same thing. I think it's just going to be a wait and see, because we're not even a year into this pandemic, right? Yeah. Another big question we get is people just wanting more information about MIS-C. And so that stands for multisystem inflammatory syndrome in children. Have you researched or read a bit around that?
I have. And fortunately, if we think of COVID in kids as super rare, kids getting super sick with COVID is even more rare. And then fortunately, this again falls into that even more rare. So we're talking about something that, at least as of right now, is a super, super rare thing, but it is scary. Without getting sort of too in depth into the science, it's this essentially inappropriate inflammatory response where the vast majority of the time the body appropriately, sends out immune cells to help fight an illness. And then in a small subset of children, it's a really inappropriately large response. And we're seeing kids that are needing to be hospitalized, and they're spending a long time in ICU and are having to be treated with medications that essentially are being used to calm down their immune system to help get them through it.
And now, did you find in your research any risk factors for kids getting MIS-C?
No. And if you found something different, let me know. It was because even when I was reading about it, it was that it could be so far after the initial illness, right? In that it's sort of this syndrome that can occur weeks after they've had COVID, and that secondarily they end up with this big inflammatory response. And
no, and I found the same thing in that it's interesting that it's about 2 to 3 weeks post-infection that it typically presents. And one thing I think is important to clarify is that it is not, as initially thought, Kawasaki-like. It's not typically that coronary artery aneurysm that we're seeing, but actually a cardiomyopathy, which is like a impairment of the function of the heart, not the heart blood vessels. Yeah, but I think it's just really rare. What I found was about 0.6% of kids who get COVID get MIS-C. So less than 1% of children. And we know children, it's rare for them to get COVID. So we're looking at very small numbers here, and fingers crossed it stays that way.
Oh, and to try to kind of put in context, when we're talking really small numbers, I was just looking at the data for Canada of sort of how many people have been hospitalized with COVID. And of all the hospitalizations, only 1.4% of hospitalization. So not just all of our cases in Canada, but only 1.4% of hospitalized cases are in kids. And then we're sort of talking about these smaller subsets after that. So when we're saying it's rare, this is rare stuff.
Extremely rare. Yes. Be reassured. Yeah. Now, a question we get a lot of, and I don't know if you get this as much in the work you do, but COVID in newborns and infants, and I struggle to find much in the literature around this. And I don't know if you've found anything.
No, to my knowledge, there's only one case that I was able to find that they think is true vertical transmission. So what we mean by that is that a pregnant mom that had COVID that then transmitted it onto their infant child. But yeah, it's, again, because it's sort of rare. And then often so many women that are pregnant right now have been taking so many precautions to really protect themselves and to stay isolated that we're just not seeing a lot of it.
No, we're not. And what's really interesting is actually I saw there's this very famous medical influencer, Mama Dr. Jones. You're probably familiar with her. And she was arguing, and I think I agree, that it may not even be truly vertical transmission because it could be. So it's IgG crosses the placenta. So that's one of the immune globulins that we know goes from mom to baby. IgM typically doesn't. But in this case, I think the pregnant mom was so unwell that there was probably a lot of vascular damage to the placenta. And it may have been that the IgM passed over simply because the placenta was so damaged. Interesting, right? And I think we're just going to need to see more numbers to know, is there a risk of vertical transmission or not? Yeah. There's still so much to learn. Another question that we get a lot, you probably don't get this at all, is should I breastfeed if I get COVID? And our answer is 100% yes, unless you're physically too unwell and unable to. So if you're hooked up to a ventilator in, the ICU, you probably won't be breastfeeding. But absolutely, even if you test positive, wear a mask, wash your hands. Some people talk about washing the chest. I think that's probably unnecessary, but absolutely right now, all the governing bodies recommend for breastfeeding.
Absolutely. There was some, when I was just looking today, the WHO and the CDC are slightly different on their recommendations of how you're talking about cleaning the chest and everything. And the WHO seems to be leaning a bit more that way in cleaning every part of your device. And the CDC seem more to think, no.
Yeah. It's just like,
yeah,
you got to survive, right? Having new kids is hard enough, right? Can you imagine? Another question we get a lot of, and we don't have the right answer, but we can have a conversation around it, is what about visitors in the home when you have young kids or newborns? And I think this is so individual that it's hard to give a good answer. I don't know if you have any sort of general advice you give people.
Essentially, it's I'd like to think that the more we all understand how this virus is spread and how it gets transmitted, then the more that we can then understand what decisions that we feel comfortable with. When it comes to visitors, and especially in that early time, or when the conversation is usually around grandparents and who are we seeing when we're trying to protect certain people from the illness, but we still want to maintain relationships. And it's what is the risk of not seeing certain individuals in your life versus your unique situation. In our household, because I'm an emerge doc and my husband's a police officer, we feel that we're out in the public a lot. And we have kids that are older, and so we can do sort of virtual visits with grandparents. And so that's mixed a little bit with outdoor visits. But I consider both him and I people that have to have much more contact with the public than the average individual that might be able to have grandma and grandpa in the home with the newborn, because they don't really have a big bubble and they can keep things really small and keep things really tight. And thinking back to when my kids were little and them not being able to have snuggles with grandma and grandma, like that would just break my heart.
Oh, absolutely. I think it's bang on. Like, if you can keep your bubble small, if you can wash your hands, wear a mask whenever you're out in public, it's all about risk mitigation and also just what is your risk tolerance, right? And I think, my husband points out things like we get in our car every day and we drive. That's a risk. There's always a risk of being in a motor vehicle accident, but we still do it. We just don't think about it anymore. So really having that good conversation with your partner and with your family. And there's a Dr. Tally Bogler from St. Mike's Hospital in Toronto wrote a really great article that we'll link in the show notes as well about having visitors around the time of COVID. But I think you're right. Like if you're looking at grandparents in their 80s, and we're looking at, our last question is, how long will this last? If we're looking at a few years before we really know, there could be an opportunity missed of spending quality time with grandchildren.
Absolutely.
Yeah. So I think that's a good segue into our last question. Okay, Dr. Michelle, I want to know, how long will this all last?
Isn't that what we all want to know? Short answer is I don't think anyone really knows. It seems, I would say my longer answer is best estimates seem to be at a minimum. We have at least a solid year and a half at the best case scenario of this. What are your thoughts?
I would say 18 months is sort of me too. Cause I'm thinking, okay, we need to have a vaccine that's gone through phase 3 successfully. And then we need to roll it out, and we need that's a huge vaccine campaign. And then we need at least 70 to 90%, right, of the population vaccinated. And we probably won't be able to vaccinate pregnant people because it's probably not being tested in pregnant people. And I think we're looking at least 18 months. And that sucks.
So back to that visitors and stuff in the home, it's kind of selecting those special key people in your life and finding ways that you can do that safely, right?
Absolutely. Well, thank you so much for doing that research and chatting with me. I think this is such an important topic that isn't really covered, because people are just learning about COVID in general. So to have a good conversation just about COVID in children is really helpful. And it's been really fun having you on here.
Thanks so much.
If you enjoyed listening, please head over to iTunes, subscribe so you don't miss any new episodes, and please leave us a review. If you found this helpful, take a screenshot and share on social to help other mamas access this information. Check out our website at www.shefoundhealth.ca and join our community. We send out weekly emails and release new content focused on this incredible time in your lives. We'll also be sharing exclusive offers, so be sure not to miss out.